Have you ever experienced persistent skin itching and dismissed it as a simple allergy, resorting to over-the-counter medications without seeing a doctor? Pause for a moment. Could it be a sign of something more serious, like liver cancer? The story of Jane, an ordinary woman from Brooklyn, New York, will shock you. What seemed like a harmless itch on her leg turned out to be a life-threatening illness. So why can a minor symptom like skin itching be a warning sign of liver cancer? And more importantly, are you overlooking similar signals from your own body? In this video, we'll delve into the critical warning signs you must never ignore, how to recognize them, and how to protect your health. Are you ready to discover the truth? Let's get started. Have you ever had persistent skin itching or other strange symptoms? Share your story in the comments. It might be a way to make you and everyone else more aware. Liver cancer, the silent enemy in your body. First, we need to understand what liver cancer is. Liver cancer occurs when cells in the liver start to grow abnormally, uncontrollably, and form malignant tumors. There are two main types: primary liver cancer, which begins in the liver cells themselves, and secondary liver cancer, when cancer from another organ, such as the lungs or colon, spreads to the liver. The frightening thing is that liver cancer often has no obvious symptoms in its early stages, so many people are diagnosed when the disease is already advanced. That's why a small sign like skin itching could be the key to saving your life. Liver cancer is not just an individual problem. According to the World Health Organization, it's one of the deadliest cancers in the world, claiming over 800,000 lives per year. In the United States, the rate of liver cancer is also high, especially among those with a history of hepatitis viruses or heavy alcohol consumption. So, how can your liver, a vital organ, send warning signals through your skin? Let's look at the first sign: skin itching. Skin itching, more than just an allergy, it could be a signal from your liver. Have you ever felt an annoying itch, especially on your legs, arms, or all over your body for several weeks without a clear cause? Don't just assume it's due to the weather or allergies. When the liver is damaged, such as in cases of liver cancer or hepatitis, it can stimulate the nerves under the skin, sending signals to the brain and causing a severe itching sensation. This isn't a normal itch that goes away after a few scratches. It's often persistent, widespread, and doesn't improve even with allergy medication. Jane's story is a clear example. She thought it was just a skin allergy and took medication herself, but the itching got worse, spreading from her legs to her entire body. Luckily, she saw a doctor in time and was diagnosed with primary liver cancer. But not everyone is that fortunate. Many people overlook this symptom, and by the time the disease progresses, treatment becomes much more difficult. So, how is skin itching related to the liver? When the liver isn't working properly, it can't eliminate toxins and waste products as it should. These substances build up in the blood, stimulating nerve endings under the skin and causing a severe itching sensation. This isn't a normal itch that goes away after a few scratches. It's often persistent, widespread, and doesn't improve even with allergy medication. Are you experiencing a long-lasting, unexplained itch? Or do you know someone who has? Leave a comment and we can discuss whether it's a sign to be concerned about. What to do if you have persistent skin itching. Don't self-diagnose and self-medicate. Here are the steps you should take. Document your symptoms. Keep a record of the frequency and severity of the itching. When does it happen? Does it spread to other areas? Are there other symptoms such as yellowing skin or fatigue? See a doctor immediately. Make an appointment with a doctor, especially a hepatologist or liver specialist. Ask for a liver function test with a blood draw and an abdominal ultrasound. Avoid self-medicating. Allergy medication may temporarily reduce the itching, but if the cause is from your liver, you're just masking the problem instead of solving it. Follow-up. If the doctor suspects a liver problem, you may need further tests, such as a CT scan or a liver biopsy. Checkpoint. After the tests, make sure you get clear results and understand your liver's condition. If the doctor confirms a liver problem, follow the treatment plan immediately. Skin itching is just one of 4 dangerous signs related to the liver. Next, we will explore 3 more signs: yellowing skin, spider angiomas, and abnormal bleeding. These symptoms may be occurring on your body without you even realizing it. Are you ready to continue? We've just learned about skin itching, a liver warning sign that many people overlook. But that's not all. Your liver may be sending other silent signals, and if you don't notice, the results can be serious. Let's explore the next 3 signs: yellowing skin, spider angiomas, and abnormal bleeding. Are you experiencing any of these? Listen carefully because this information could save your life. Yellowing skin, when your body changes color, your liver is crying for help. Have you ever noticed that your skin or the whites of your eyes are starting to look yellow, even slightly? It's not due to the lighting or fatigue. It could be a sign of jaundice, a common symptom when the liver has problems. Jaundice occurs when the liver can't process bilirubin, a waste product from the breakdown of red blood cells. Normally, the liver filters bilirubin and excretes it through stool or urine, but when the liver is damaged, such as from liver cancer or hepatitis, bilirubin builds up in the blood, causing the skin, eyes, and even nails to turn yellow. Jaundice isn't just a cosmetic problem. It often comes with other symptoms like dark urine, pale stools, or a feeling of heaviness in the upper right abdomen. If you see these signs, don't wait. A real-life case in the US involved a man named John, 45, who thought his yellowing skin was due to a nutritional deficiency. He postponed seeing a doctor, and when he finally went to the hospital, he was diagnosed with advanced liver cancer. Don't let your story be like John's. Take immediate action. If your skin or eyes show signs of yellowing, see a doctor immediately. Ask the doctor to check your liver function with a blood draw, specifically your bilirubin levels. A simple test can help you catch the problem early. Have you ever seen anyone with jaundice, or have you noticed any discoloration on your own body? Share in the comments so we can talk about it and understand more. Spider angiomas, small marks, big risk. The next sign might sound strange: spider angiomas. These aren't normal bumps, but small red or purple spots on the skin, often with blood vessels radiating out like a spider web. You might see them on your chest, back, or arms. But why are they related to the liver? When the liver is damaged, it can't efficiently metabolize the hormone estrogen. The estrogen that accumulates in the body causes blood vessels under the skin to expand, turning into spider angiomas. This is a specific sign of chronic liver disease, including liver cancer and cirrhosis. The worrying thing is that many people mistake spider angiomas for red marks from an allergy or an insect bite and overlook them. What to do when you see spider angiomas? First, check if they are expanding or increasing in number. If you see these spots along with fatigue, abdominal pain, or itchy skin, see a doctor immediately. The doctor may recommend a liver ultrasound or a blood draw to assess the liver's condition. Don't think that a small mark is unimportant. One patient in the US discovered liver cancer because he noticed spider angiomas on his chest, and timely surgery saved his life. Challenge yourself. The next time you shower, check your body for spider angiomas. If you find any, take a picture and observe it for a week. What do you see? Share the results in the comments. Abnormal bleeding, a red flag you can't overlook. The last and most serious sign is abnormal bleeding. You might notice bleeding gums when you brush your teeth, unexplained bruises on your skin, or even bleeding in the digestive tract, such as vomiting blood or having dark or black stools. This is a sign that your liver is severely weakened. The liver plays a crucial role in producing factors that help blood clot. When the liver is damaged, such as from liver cancer, it can't produce enough proteins to help the blood clot. As a result, you bruise easily, and a small cut can become a major problem. A sad example is that of Mrs. Rose, a vendor in Los Angeles. She often had bleeding gums but thought it was due to a vitamin C deficiency. When she fainted from a gastrointestinal bleed, doctors found she had late-stage liver cancer. Take immediate action. If you have any signs of abnormal bleeding, go to the hospital immediately. Ask for a liver function and blood clotting test. This is a danger sign, and time is a life and death factor. Have you ever had bleeding gums or unexplained bruises? Tell us your story in the comments. We can discuss whether this is a sign to be concerned about. Skin itching, yellowing skin, spider angiomas, and abnormal bleeding. These 4 signs can occur separately or together. The important thing is to listen to your body. Don't think a small symptom is insignificant. The liver is a silent organ, but when it cries for help, you must act immediately. In the next section, we'll delve into the critical risk factors that make you more susceptible to liver cancer, from eating habits to hidden diseases. Can you guess which factor is the most dangerous? Stay tuned to find out. The silent enemies of the liver. Liver cancer doesn't happen by chance. There are risk factors that make you a target for this disease. Understanding them will help you prevent it effectively.